What is hyperthyroidism? The thyroid is a small gland located at the front of your neck. Hyperthyroidism, also known as an overactive thyroid, occurs when this gland produces more thyroid hormones than the body needs. The two main thyroid hormones, T4 and T3, help control many essential body functions. These hormones influence metabolism, heart rate, body temperature, muscle movement, growth and development, and even mood and immune function. When hormone levels are too high, many body systems begin to speed up and may cause symptoms, which may include fast or irregular heartbeat, unexplained weight loss, anxiety, fatigue, shaky hands or tremors, excessive sweating or heat intolerance, frequent bowel movements, trouble sleeping, or changes in menstrual periods, pressure or pain behind the eyes with eye bulging, swelling in the neck, known as a goiter, and may cause difficulty swallowing. Who is at risk? Having a family history of thyroid disease, having certain autoimmune or endocrine conditions such as type 1 or type 2 diabetes, pernicious anemia, or primary adrenal insufficiency, consuming large amounts of iodine through food or supplements, taking medications that contain iodine, using nicotine products, and having been pregnant within the past 6 months. Causes of hyperthyroidism: Graves' disease, the most frequent cause, where the immune system overstimulates the thyroid; overactive thyroid nodules, which produces excess hormone; thyroiditis, which means the thyroid is swollen or irritated, can cause a short term increase in hormone levels. How is it diagnosed? Diagnosis usually involves a medical history and physical exam, blood tests, imaging tests when needed to identify the cause. Treatment and management. Treatment focuses on normalizing thyroid hormone levels and addressing the underlying cause. Options may include medications to reduce hormone production, surgery, or radiofrequency ablation for certain overactive thyroid nodules. The best approach depends on factors such as age, overall health, and personal preferences, and should be decided with a doctor. According to the CDC and ATA, pregnant women or those planning a pregnancy should work closely with their healthcare provider and take a daily multivitamin or a prenatal supplement containing iodine. Hyperthyroidism is treatable. With proper care and follow up, most people can manage symptoms and maintain a healthy life. Always work with your healthcare provider to find the best treatment plan for you.